Chiromo Hospital Group marks its 25th anniversary. Our quarter-century journey has been full of opportunities and challenges. As it now, and through the leadership of the government, through the relevant regulatory authorities, we have the first level 5 mental health care facility in sub-Saharan Africa, Your Excellency. This branch hosts of 180 beds. And Your Excellency, I can assure you, every day we offer an average of 100, minimum of 100 inpatient care. Today, as we are standing here, we have at least 100 Kenyans and other members of this world receiving quality psychiatric care. This particular brand is key on partnerships. Our number one partner are our staff members. Today, we have 212 staff members who provide that dignified, quality mental health care. They are led by psychiatrists. Our 38 partner psychiatrists lead the teams in admitting and providing that quality care within our brand. We have 52 clinical psychologists. These clinical psychologists, working with other professional team members, every day work to exceed the expectations of those who choose to walk through our doors. Mental health care. The World Health Organization says that it is the ability to give an individual optimal wellness, optimal opportunity to enjoy their life, to deliver in the economic development in the best way they can. Mental illness negates that. The space in which we operate, Your Excellency, is an emerging epidemic. The Global Mental Health Action Plan, the Kenya Health Policy, the Kenya Mental Health Action Plan 2021-2025 clearly highlights that this is an emerging epidemic. When COVID hit, the gains, the fragile gains, as I would call them, Your Excellency, in this field were either halted, disrupted, or totally disappeared. These gains on the mental health care landscape with the coming of COVID impaired access to quality mental health care. Many would not access quality mental health care that the actors were pushing towards the same. 300 million people. Of the 7.9 billion people inhabiting Earth, 14% are estimated to have mental health care needs. The 1.1 billion people trickle down to Kenya. When the President, His Excellency, formed the task force on mental health to just understand the magnitude of this problem, they said that 25% of those who seek outpatient care have mental health care needs. 40% of those who are admitted require mental health care needs. Are they aware? Are they receiving that care? No. Up to 75 to 80% are not aware that they have mental health care needs. It is an emerging epidemic. The resources, that there is need to escalate, mobilize and allocate more resources to this emerging epidemic. As an NCD, mental illness is preventable. The determinants, the socio-economic determinants, risk factors that predispose individuals developing mental illnesses can also be addressed at their root causes. And as Chiromo Hospital Group, we believe, in line with the WHO, that there is no health without mental health. And we will work with all the partners to be able to protect the mental wellness of Kenyans and beyond to promote the mental wellness of Kenyans and beyond, and, if required, to provide the restorative mental health care services. That can only be possible with this collaborative team.
I stand here on behalf of Jubilee Insurance and also on behalf of the private insurance fraternity through the Association of Kenya Insurers. First of all, to congratulate the Chiromo Hospital Group for the work that you've done, to bring us here together to witness this monumental Bustani facility. Going forward, I see a lot of opportunities, and we see huge opportunities as your partners, particularly those in the insurance space. And I want to challenge us to embark on 3 things that I think will make a huge difference in how we move forward. One is for us to start a journey together as partners to normalize mental wellness. And we stop referring to it as not just as mere illness, but recognizing that it's wellness. The second thing that I want to challenge the Chiromo Group is let's expand the facilities and make the healthcare even more affordable. There's technology, there are ways we can expand across the country and make it more affordable. And lastly, let us create financing for it. We can create financing solutions to make sure that those who require mental health can be able to pay small amounts every month, and when they need care, they can get it.
We must give priority to mental health, give the resources to mental health amongst the NCDs in this country. So I believe that what we are doing here today to enhance and to embrace what Chiromo hospital groups are doing is really a big support, and I'm so delighted that Your Excellency, you are the one who is here today to witness what these hospital groups have done.
The Kenya Medical Mental Health Action Plan 2021-25 reports that 1 out of every 4 Kenyans suffers from mental health disorders, and this is a significant figure. A lot needs addressing to ensure that these people are not left out. While many cases are left unreported, those that manage to seek help in health institutions are challenged by the high costs of healthcare services. The government has made access to affordable healthcare services to all Kenyan residents, and one of the priorities being the Big 4 strategies, where it envisages universal health coverage by 2022.
Mental health services in the public sector will give our people the dignity that they are entitled to. This is our determination, and with God's help, we will deliver dignity to our people. The World Health Organization makes it very clear that there is no health without mental health. I will ask a number of people to come and just tell you their own personal stories, because we know that without hearing the stories of our brothers and sisters, this whole thing is just theoretical and totally meaningless.
I was diagnosed with bipolar mood disorder in the year 2012 in Margarate hospital. Before I was able to meet Dr. Frank Jenga, I was going through a depression state. And most people say I am depressed, but they don't really know what depression is. In a nutshell, I would tell you, depression is all about you do not have the energy to wake up. You're this energetic person, you're this outgoing person, but in an instance, you become the totally opposite person that you used to be. I want to encourage people out there, whether you have a mental illness, whether you come from a humble background, there's life, there's hope. Do not give up.
My relationship with Chiromo started about 7 months ago, but my experience of mental struggles is much older than that. I have a list of diagnoses that I will see, syndromes and symptoms. 27th December last year, I met Doc. He walked into my room and asked me, "What can I do for you?" My number one problem that day was I needed to sleep. The next day we had a chat. And in one of those discussions, he looked at me, and maybe I'll let him explain what the diagnosis is.
Julie has had a problem all her life because she has always believed she's abnormal. And her abnormality turns out, is just being so clever. Danish, tell us what a young man goes through when they're depressed.
I'd say it's like walking with a cloud of darkness over your head while everyone around you is in the sunshine and smiling, and you're feeling like you're awkward and there's something wrong with you. Also, it affects your finances, affects your relationship, affects your career, affects almost every other area of your life. And especially for high achievers, people who really love, because you know very well that the condition I have, I'm driven by...
What is your condition, sorry, forgot?
It's ADHD.
Tell us where you have now taken this ADHD energy, this high intellect. What are you doing for the people of Kenya?
First of all, I accepted that I am not broken. I'm different, but I live in a normal world. And a normal world is, normal people are the ones who break things. Abnormal people fix them. You see, like what she's doing. And you know, I believe my Ferrari engine brain, and we're changing this world. So last year, I registered an organization called the Wellness Tribe. And as we speak right now, we've done our first survey. We are offering mental health support for young people in 9 constituencies in Nairobi through development partners. And as we speak right now, we're just piloting that still mental health support in the constituency I come from called Nyando because of floods and COVID, and we're basically big on social protection.
You are a trained nurse.
Yes, I am.
You have gone through a condition we've told depression.
Okay.
You've also had surgery. Mm-hmm. Tell us the difference between the pain of depression and the pain of surgery.
The pain of surgery is physical pain, and the pain of ADHD and depression is something that you cannot really explain. And when you have the surgery, everyone comes with flowers. You have a whole community behind you. You have support from everyone, your workplace and all. But the moment that you say, look, people, I am depressed and I have ADHD, there is no one.
Thank you very much.
Thank you.
Thank you very much. Ruth. In return to all the good the country has done for you and the recovery process and that sort of thing, tell us about human libraries. What is a human library?
A human library is where you come to read books, but you find human beings. So I have a title to a book, they have a title to a book, and you choose the book you want to read. So that is what is a human library. You have a human book and a human reader.
So people come to you,
yes,
and they say, Ruth Wamboi,
yes,
tell us about your condition. What do you tell them?
I am not dumb, I am different. I was diagnosed 2 years ago with ADHD, severe depression, anxiety, and PTSD.
How many courses were you admitted to study at the University of Nairobi? Tell them one by one quickly.
I was admitted to do actuarial science, BCom, biomedical, and medicine.
You went to actuarial science class?
So I went to actuarial science. I did first year, second year, got bored. And on my way to campus one day, I just alighted from the matatu and called my mom and I told her I quit. And I don't know what I was going to quit to do. But again, I had failed in my previous semester. I was supposed to redo. But I was failing the units that everyone passed. And I was passing the units that everyone failed without attending class.
Thank you very much. The bottom line, and this is the point that we want to make, Your Excellency, is that all these are very, very bright boys and girls, all of who have had difficulties and challenges in class. And ordinarily what would happen, we just let them go and drop off and never look after them.
I want to urge the management and mental health specialists in this hospital to offer mental health education and facilitation now more than ever because of the current COVID-19 pandemic, which continues to affect us in our homes and in our workplaces. Nairobi residents and Kenyans in general continue to suffer in silence because of the stigma around mental health. It is a time we come out and speak freely about our mental illnesses and its effects. Let us all come together and fight this stigma and strive to prevent mental illness as well as manage it when it occurs, as we ensure our loved ones recover in dignity.
The projected prevalence rate of mental health condition stands at 10 to 15% of the global population, and a vast majority suffer from depression. In other words, we are estimating that 350 million people are affected globally. And in Kenya, mental illnesses are a significant cause of ill health, with an estimated 25% of outpatients and up to 40% of inpatients health facility visits have diagnosable mental health conditions. In terms of economics, when we measure the burden of this disease, we've come to learn that the global burden of disease, measured in terms of disability-adjusted life years, and 33% of years lived with disability are attributable to mental, neurological, and substance use disorders. And therefore, Your Excellency, ladies and gentlemen, despite the high disease burden due to mental health conditions, majority of people do not access services due to various reasons, including that these services are not available in their communities, that the services are not affordable, that we lack adequate resources and systems in terms of providing comprehensive quality care services, including also investing in human resources, medical products, and commodities. I wish to state that the public and private partnership in mental health will be a key driver to the achievement of the set targets in our plan to ensure that Kenyans achieve the highest attainable standards of mental health care. There are various opportunities and synergies that we need to explore, and we do celebrate the Chiromo Hospital Group for putting this in place and ensuring that recovery occurs in a space of dignity.
Thank you for stepping up efforts to support people struggling with mental health and raising the focus on this issue. This purpose-built Level 5 facility has indeed set new standards of mental health service delivery for the region. I call on all of us here and around Kenya to make more of an effort to increase our understanding. Our focus, our obligation and responsibility must be to draw attention to things we have ignored in the past and to begin treating mental illness as an illness at a parity with other illnesses. Appropriate medical and psychological support where patients are treated with love and dignity is crucial to patient recovery. However, we cannot leave mental health care solutions to science and laboratories alone. We need to be aware of the cost of untreated mental illness. The loss of school days, loss of work days, dropout, marital distress, and also lost opportunity cost, the economic effects of individuals who are not functioning at full capacity. As individuals, parents, role models, let us ask ourselves what steps we can take to demystify mental illness. What must we do to guard against stigma and discrimination, which is deeply entrenched in our society? One of the ways we can change the misguided perceptions is through more public awareness. I know that heightened advocacy and awareness works through my own work in Beyond Zero by highlighting maternal and child health. We also have many great examples of how advocacy works through joint collaboration through the media with community support. Today, I commit to add my voice to raise awareness about mental health and to support the global collaborative campaign, Tufunguke, to encourage the voices that are silent to speak up and be heard. We can do this together.